Hello, good morning, friends. Now we'll be discussing about lymphangiomas. So let's get started. Lymphangiomas, also known as cystic hygroma or cavernous lymphangioma, these are the congenital condition and the resulting from the failure of the lymphatic sac to develop proper connection and drainage with the lymphatic system, resulting in formation of the focal lymphatic cyst. So lymphatic sacs, improper connection and drainage, resulting in formation of focal lymphatic cyst, that is sequestration. Clinical presentation will be swelling in the posterior triangle of the neck. It could be present even in the axilla, mediastinum or groin. These are partially compressible and brilliantly transilluminant swelling. Antenatal period. Presentation is commonly in the antenatal period. The mother will present with polyhydramnios because the baby is unable to swallow the amniotic fluid. Mass may be apparent at birth, but even may appear or enlarge rapidly after early weeks of birth. So these are most commonly present by the age of 2 years, and neck lesion may extend into the axilla or the mediastinum in 10% of the cases. Cysts are lined by the endothelium and filled with lymph, and these cysts are unilocular and multilocular, but most commonly these are multilocular. So multiple cysts infiltrate the surrounding structures, distort the local anatomy, especially in the tongue, floor of mouth and deep neck, and there will be extensive lymphocytic infiltration surrounding the adjacent connective tissue. It may contain nests of vascular tissue and poorly supported vessels, resulting in bleeding sometimes and sudden enlargement of the swelling and discoloration. Infection by staph or streptococcus is another risk causing trouble. Then respiratory distress due to airway compromise, especially in the prenatal time. The perinatal asphyxia, the treatment will be exit procedure where we will be uh, going for orotracheal intubation and emergency tracheostomy while the patient remains attached to the placenta, and exit is ex utero intrapartum technique. The management, initially you can go with image guided sclerotherapy. Cystic excision may be done when the aspiration and sclerotherapy has failed or is inadequate. Conservative excision and unroofing of the remaining cyst with repeated partial excision of the residual cyst and sclerotherapy. This is the combined approach for the treatment. The total removal of all the gross disease not possible due to extensive nature and intimate relationship with the nerves and blood vessels, and not necessary because the condition is benign. Then we come for capillary lymphangioma, that it is the failure of embryological remnant to connect to the efferent channels. Cystic lymphatic malformations are formed, resulting in simple capillary hemangiomas. The location being truncal, mesenteric, intestinal or retroperitoneal. So this was all about cystic hygroma. Hope you have understood, and thank you for watching, and keep studying, keep growing. Lastly, I would like to thank Chandana Shri Ma'am for sharing the wonderful notes. I have shared the link for the notes in the description below. So see you in next video. Thank you.